Hello everyone, this is Dr. Kashish Grover, your PSM faculty at AIIMS. Now I'll be discussing about your CBT exam, all the PSM questions asked in your CBT exam. So question number 1, eligible couple register is maintained by. See, eligible couple register is maintained by A&M. Second point related to this is where. Sub-center. Eligible couple register is maintained by A&M at sub-center. Option B is correct. So following is the image of one contraceptive method. Which of the following is true regarding this method? So this is Chaya. This is Chaya. The older name was Saheli. The old name was Saheli. This contraceptive pill is a non-steroidal pill. Non-steroidal pill. This non-steroidal pill was developed by not US FDA, CDRI Lucknow. CDRI Lucknow. It is not a barrier method, right? Now option B is correct. Yes, we know this is a non-steroidal pill. What about option D? This is not given once a week for first 3 months. This is a 30 mg tablet given twice a week for first 3 months. For first 3 months. After the completion of 3 months, now the lady can take once a week. So when any woman is starting, she needs to take twice a week. Once she has taken it for 3 months, now after 3 months she can take once a week. That is why D is also not the correct option here. So according to the options given, option B is the correct answer. Now, so in this question, they are asking you about couple protection rate. They're asking you about couple protection rate. What is the formula for couple protection rate? It is the number of eligible couple using any one of 4 approved contraceptive method divided by total eligible couple multiplied by 100. Now total eligible couple. In question they have given total population 5,000 and 150 eligible couple per 1,000. For 1,000, 150. How many for 5,000? 150 for 1,000. What about 5,000? So if you solve, you will get 750 eligible couples. So denominator 750. Now number of eligible couple using any one of 4 approved method. What are 4 approved method given in your question? So it is condoms, IUD, OCP and sterilization, which includes tubectomy and vasectomy. If any couple is using any of these 4 methods, then we consider couple protection rate. We consider in couple protection rate. So if you calculate all of them, you will find they are 600. If you add them, they are 600. 250 plus 150 plus 100 plus 80 plus 20. So 600 divided by 750 multiplied by 100. The correct answer will be 80%. Now, in this question they have given there is one woman, she is laborer by profession and also she is pregnant. Now you need to calculate the diet. Now you need to calculate the dietary requirement, energy requirement and kilocalorie. A heavy worker, a laborer is a heavy worker. A heavy worker woman, she requires around 2700 kilocalorie. Any pregnant woman, she requires 350 extra. 350 extra. So approximately 3050 kilocalorie required by a laborer woman who is pregnant. So here the correct answer will be 3100 kilocalorie, because this is the most near value to 3050. Now, true regarding egg. Egg is best to consume raw? Absolutely no. Raw egg contains avidin. Raw egg contains avidin. This avidin inhibit biotin synthesis. This avidin inhibits biotin absorption, right? So that is why it is not advisable to consume raw eggs. Option A is not correct. Option B, egg is a reference protein. Yes, egg protein is a reference protein because the NPU is highest. Net protein utilization is highest. This statement is correct. But let us see option C and D. Protein content is 6 gram per 100 gram of egg. Absolutely no. It is 6 gram per egg. One egg is around 60 grams. So 6 gram protein in one egg, and one egg is 60 gram. It is not 100 gram, right? It is not rich in carbs. This is also not correct. So here the correct answer is option B. Iodine content of salt at production level. At production level, it should be more than 30 ppm. At consumer level, it should be more than 15 ppm. At production level, more than 30. So here the correct answer is option C. Which of the following is not test of pasteurization? If I broadly divide test on milk, there are after pasteurization, before pasteurization. Methylene blue test is the test which is done before pasteurization. Rest of the three tests, they are done after pasteurization. That is why they are known as test of pasteurization. Right? So methylene blue is not a test of pasteurization. This is done before pasteurization. Here the correct answer is option D. Which of the following measures designed to prevent hazard of disaster? This is the definition of mitigation. What is mitigation? Mitigation, they are the measures which are taken to prevent hazards of disaster. Option B is correct here. Not true regarding the following device. So this is ice pack. This is prepared in deep freezer. This is very correct. It is filled with water. Only water is used. And the water should be filled up to the mark, because after filling the water, we are going to freeze it, and the water expands, right? When the ice expands, right? After the freezing, the ice expands, right? The capacity is 320 ml. This is true. These two holes are there to put the reconstituted BCG and OPV. This is also correct. For day carrier, 4 ice packs are used. This is not correct. So this is the answer here. For day carrier, 2 ice packs are used. For vaccine carrier, 4 ice packs are used. So here option D is correct. Which of the following ways should go in the box shown? So this is a white box. This is for sharp metallic waste. This is for sharp metallic waste. Here the example is needle. Here the example is needle. Okay, what about other options? Placenta. This goes in yellow. Gloves, they go in red. Empty glass vial, they go in blue, because in blue we throw broken glass. Broken glass, right? Now, which of the following parameter is most likely to be affected when data values are skewed? So most affected is mean. Mean is most affected. Mode is least affected. Mode is least affected. So here option A is correct. All the immigrants at international airport are screened for fever to rule out COVID-19. Prospective screening is done for benefit of others. Here we are doing screening for the benefits of other people in the community, right? Because we are detecting any case as early as possible so that the case does not spread the disease in the whole country. That is why A is correct option here. Regarding sustainable development goal, which is true, there are total 13 goals. Absolutely no, there are total 17 goals. Goal 7 is health related. No, it is goal 3 which is health related. Target is to reduce 33% premature death due to NCD. That is absolutely correct. That is absolutely correct. Target is to achieve MMR less than 100. Absolutely no. MMR less than 70. MMR less than 17. Right? So here option C is correct. A patient was recently diagnosed with prostate cancer. He is in stage 4 and prognosis is very poor. Which of the following health communication technique should be used? For breaking the bad news, spikes technique is used. For breaking bad news, spikes technique is used. An employer wants to give knowledge on hand washing and proper use of sanitizer to all employees. Which of the following technique is used? In this case, demonstration is the best method here, because demonstration is learning by doing. It is learning by doing. We perform activities. So all the steps of hand washing and proper use of sanitizer are performed step by step in front of audience. So these two keywords are very important. Activities are performed step by step in front of audience. Now, full form of VED. It is vital, essential, desirable. It is vital, essential and desirable. So in every hospital, in every healthcare setting, all the supplies, they are of 3 types. One is vital, then it is essential, and last is desirable. Vital means this drug is very important and should be present in the supply every time. For example, paracetamol, right? For example, paracetamol. Amoxiclav or any other antibiotic, it is essential for the hospital. Desirable is anti-cancer drug if the hospital is a big level hospital. You learn it like that, right? So vital, essential, desirable. Option A is correct. Study of physical, social and cultural history of man is anthropology. Option C is correct here. Anthropology is study of social and cultural history of man. Mr. Ram met an accident on 26th April 2022. He lost his foot and now he cannot walk. And he also lost his job. His unemployment is handicap. What is impairment? Any physiological or anatomical loss What is disability? When the person is not able to perform daily activities. So, the person lost his foot. This is impairment. Can't perform daily activities because he cannot walk. He cannot walk. This is disablement. And handicap is he cannot fulfill role in society. Cannot fulfill role in society. That is why option D is correct. Asha worker are going house to house. House to house is active surveillance. House to house is active surveillance. When we are in our health system and the data is reported to health system, this is passive surveillance. When we collect data from all the sentinel sites for missed cases, this is sentinel surveillance. Here the correct answer is active surveillance. Now this lady died because of breast cancer. She is in stage 3. Her daughter was advised mammogram. By doing a mammogram, what you want to do? You want to detect the breast cancer if it started in her daughter. So here you are doing screening of disease. The correct answer is secondary prevention. Natural experiments are example of non-randomized trial. Natural experiments are example of non-randomized trial. Other examples of non-randomized are pre-post study and uncontrolled trials. Uncontrolled trials. Right? These two are example of non-randomized. Now, in a hospital, a study was planned to know association of folic acid and neural tube defect. 600 pregnant women visiting for ANC were included. 600 pregnant women who were visiting, they were included. Right? Now, please understand the language of question with me. So, 600 women, they were included. And they were asked about their folic acid consumption. Out of 600, 40% women said they consume folic acid, and rest of the women, they said they do not consume folic acid, and 30% of those women not consuming folic acid developed neural tube defect. So those women who were not consuming folic acid, 30% developed neural tube defect. So this 30% is not the 30% of this total. This 30% is of 60% women, right? And here the women who were using 10% developed neural tube defect. So what is happening here? So this is a cohort study. This is an example of cohort study. This is example of cohort study, right? So guys, to solve these kind of questions, just focus on the direction where the researcher is going. It is from exposure to disease or from disease to exposure. Is that fine? No. A 40-year-old man was bitten by a dog 10 months back. He got all scheduled post-exposure vaccination. Now he's complaining of monkey bite again. So this is a case of re-exposure. This is a case of re-exposure. If there is a case of re-exposure and it is within 3 months, you need not to do anything. But if it is more than 3 months, then we give 2 doses and immunoglobulin not given. Immunoglobulin not given again. So what is option A saying? Start post-exposure rabies vaccination 03728? No need at all. Start equine immunoglobulin? No need at all. No need of vaccine and immunoglobulin. This is also not correct because 10 months already passed. If instead of 10th month the question was 2 months, then I can say okay, D is the answer. But here the correct answer is option C. Start vaccination on day 0 and 3. Now, the lesion shown in the image shows in which of the following disease. So this is Koplik spot. Koplik spot are seen in measles. Koplik spot is seen in measles. Now, according to the image given, so this is tracking of blood pressure. It says if there is low blood pressure in childhood, then the individual will have low blood pressure in adulthood. If there is a child who is having high blood pressure in childhood, that child will have high blood pressure in adulthood. So option A is correct. A study was planned among neuropsychiatric patients to know association between substance abuse and neuropsychiatric symptoms. Among the two groups of study subject, symptoms and without symptoms. So here disease is present, disease not present, and we were asking them about history of exposure. What is this? Simple. This is a case control study. Cash benefit given to pregnant women. So only two health programs given in the options, they provide cash benefit. JSSK gives free, everything free, but no cash benefit. In this we give free antenatal care on 9th of every month. Right? So two, they are providing JSY and Pradhan Mantri Matru Vandana Yojana. These two schemes, they provide cash benefit. Now the question is, under Ministry of Women and Child Development. So this is under Ministry of Women and Child Development. This is under Ministry of Health and Family Welfare. So here option C is correct answer. Total visits by ASHA under home-based young child care. Total 5 visits on 3, 6, 9, 12 and 15th month. So first visit of home-based young child care at 3rd month, then 6th month, 9th, 12th and 15th. Total 5 visits. As per triage, dead patients are black. They are categorized as black. Now, birth rate is high, and death rate starts declining. Okay, birth rate is high, death rate starts declining. This is stage 2. In stage 1, high birth rate and high death rate. In stage 2, birth rate is high, but death rate declines. It starts declining. So here the correct answer is option B.